and human models that mimic the normal functioning and the abnormalities that come with disease. So our students are exposed to laboratory models of human beings to train them on the normal function of human being and what is not normal. After they master that, the procedures in the laboratories, they now move to health facilities. And so to be able to improve access to health facilities, we engage with counties. We visit governors, we make sure we take them through the requirements of our students to graduate. And so we also ask them for access to facilities and to prevent facilities from charging our students. However, several of our governors and probably these facilities have not seen the need for ensuring that KMTC students have unfettered access. And therefore, the boost and adding of the voice by our cabinet secretary is going to improve even further the quality of training at the Kenya Medical Training College. Given that we train students who some of them come from very poor communities, and KMTC being an institution where we train for the government, we have to also give opportunities for training in Kenya Medical Training College to very poor students who otherwise would not go any other place to access that kind of training. So if they are again charged at our health facilities, it adds to their burden of accessing education. And what we want is to align our vision to the bottom-up economic transformation agenda, one of which is making sure that there is access to quality healthcare. And this is a very big one. Students of KMTC, we see today as a major step forward in making sure that as a college, we are able to consolidate our position as the model training institution, as an institution that trains not only for the country, but for the international market. And we want to thank you for creating time to also come to discuss with us this month. Thank you so much. We have 5 countries that are taking part. They're already, the presenters are already here, and they are going to do presentation in various areas. And some of the things that we are discussing in this conference is equity and access to health services in the country. We are talking about the importance and place of research in medical training. We are looking at UHC. What are the challenges? What are the successes? And how can we move forward? And what we are doing basically is to start debate on areas that we must work on to make sure that our facilities, our health systems are able to function for the benefit of the Kenyan who expects the best of us. Number of campuses, the number of students, and the demand for courses that are being offered in KMTC. Realizing that KMTC does not only train for this country, that it constitutes 85% of all the health workers that are practicing locally, but it also produces for other countries. So as we do this, there is need to increase the space in terms of making sure that we have proper inputs for training to take place. And proper inputs for training include making sure we have lecturers in classrooms, making sure our laboratories are properly equipped, making sure that we have the infrastructure for training. He has committed himself to make sure that we follow up to make sure that we are having proper student to lecturer ratios in our classrooms, making sure that the campuses that are ready for uptake and yet have not been taken up because of budgetary constraints that KMTC faces, he addresses the same, and making sure that the standards that are being offered at Kenya Medical Training College continues to rise. Act of 7 double cabs. Double cab vehicles are part of the transport infrastructure for the college. Kenya Medical Training College, that's its training in communities. It does its training in health facilities, that some of which are in local areas across the country. As you are aware, the institution is present in 45 of our 47 counties, and we continue to engage the 2 counties to make sure that we are present in all the 47 counties. But more so, our training is community-based, and it means that we must take students to those facilities that are in the community. We must also take lecturers to assess students and give them instruction in those communities. And that requires transport system. And what Honorable Dwale has done today is a big boost to the college. It means that 7 campuses will have access to transport to make sure our students are able to access rural facilities, are able to attend to patients, are able to work with and learn from these communities and be able to promote health.